Today we'll be talking to you about the Northern Meditech Taurus E Plus patient monitor. We're going to be doing a quick demonstration. So to turn it on, power button just down the bottom. A couple of seconds to power on. Okay, so first off, you can hear the alarms going off. So at the bottom here, you've got a yellow silence alarm. So you can press that and straight away you can see that the little alarm has a cross through it. So that means that all your alarms are turned off. To add a patient settings, you've got quick admit patient, patient demographics, and discharge patient. So first we're going to do a quick admit. So here it asks you if you're sure that you want to discharge your last patient, just click OK. Patient category, adult, pediatric or neonate. And whether, it says pace there, so that's whether or not they have a pacemaker. So if you select no and click OK. Your patient has now been entered into the system, so you can just click X and you can start with your testing after that. If you did want to enter the patient details, you can click on patient settings, admit patient, OK. So here you can enter their surname. If you've got the touch screen, more than welcome to use the touch screen. Otherwise, you have a little cursor here, so you can use that for whatever you need, left and right, and then to select, you just push down. Once you have your patient entered, we can go through all the settings down here. So blood pressure, to do a blood pressure you just click that button there and then it'll automatically start to blow up. If you're wanting to go through the settings down here, so you've got left and right to go through your main settings. So we've already been through the patient settings. You've got blood pressure, freeze if you wanted to freeze the ECG frame, switch. You can also switch the main setup of the screen. So you've got normal, big numerics, or the ECG 7 lead full screen. So if you don't know what these look like, you just go through the tabs here. So that's your main screen, how it normally appears with your ECG, RESP, SpO2, temp, BP, and the rest of it. And then you've got your next one, which is just two of them, just big numerics, and then all of your ECG settings there. So if we were to click on big numerics, the screen would appear like that. Back to our normal screen. If you click right, you've got more main settings that come up. You can silence the alarm like we've done just before. You've got all of your different alarm settings, so you can switch your alarms on and off. The alarm level, so low, mid or high, so that's how the volume of them that you would want. And then also some other configurations here in regards to your ECG settings. Moving on, volume settings, so how loud it is also. Print, if you had a printer option, you could always print from there and review. So that would be all of your patient details from the last patient that you had. There, all of your results would appear. Going back to the main menu, two main things that to keep in mind here, you've also got your patient setups to go through there. If you go through your alarm setups, you can also access all of the main screens from there, ECG, SpO2, BP, and then you can change all of your parameters for your alarms as well from here. That's that.